Monkeypox, a disease typically only encountered in West and Central Africa, is popping up around the world, and that includes here in the U.S. Just today, new suspected cases in Utah. And our map says one case in Florida, but breaking just minutes ago, we got news about a second case in the state, another suspected case in New York, and a confirmed case in Massachusetts. Joining us now to help us understand what monkeypox is and what you need to know about its potential spread is Dr. Anthony Harris. He's the CEO and Medical Director of HFIT Health. Dr. Harris, thanks for being here. First, what are the symptoms of monkeypox and how do you test for it?
Sure. Thanks for having me. Really appreciate it. And when we talk about monkeypox, we talk about, what it is. It's a zoonosis, meaning it usually is transmitted from animals, in this case, rats, typically and other rodents, to humans. And now it looks like there may be some maintained human-to-human spread, and that's what's concerning because that is very abnormal for this virus. This virus typically causes fever. It can cause nausea, vomiting, diarrhea, and it can also cause the symptoms of the rash, right? And the rash usually shows up about 48 hours to a couple of days after the fever has resolved. And so that's what people need to look out for by far and away. The first symptom actually to pop up before even fever is usually what's called lymphadenopathy, so swollen, tender lymph nodes. And so when we're talking about looking out for, could I be infected? Obviously, it's extremely rare still, only a few cases here in the U.S. But if there's any question, definitely consult your physician and make sure that you're doing everything to keep yourself protected.
How do you treat it?
Sure. So it's self-limited in terms of the virus itself, right? The majority of people don't have severe illness from it. The death rate from it actually is higher than what we've seen with COVID-19 in terms of it can be as high as 10%. But again, it's something that is rare in terms of transmission. So the impact, as we're hearing from President Biden, from the administration, as well as other experts, we're not anticipating a huge impact from the monkeypox at this point in time. And treatment is targeted at symptoms and alleviating some of those symptoms, particularly fever, and helping individuals remain comfortable while the virus itself subsides from your own immunity and your immune system fighting it off.
Okay, and Belgium has just introduced this 21-day quarantine required. They have 3 confirmed cases in the country. We already have at least 2 confirmed cases here in the States. Are we going to see something similar to that?
At this point in time, it doesn't appear to be that we're going to move towards, anything like we've seen in terms of quarantines of the COVID era, if you would, right? There's no indication that those type of quarantines, one, are going to be targeted at general infection, right? That right now, there's no way to really understand at the individual level, do I have monkeypox or not, until symptoms have progressed. And so certainly, if you are an individual that has come in contact with somebody with confirmed monkeypox and you're symptomatic, then that's when we take action in terms of making sure that it's limited in terms of your exposure to other people.
All right, Dr. Harris, thanks for clearing some of it up for us. Appreciate it. Coming up on NewsNation Rush Hour.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.